Okay, Professor, thanks for your time.
It's a pleasure.
In general terms, what can you tell us about the Effect HF study that's being undertaken?
The Effect HF study is a very important study looking at people with weakened or damaged heart muscle, what's called heart failure. In this study, they're looking at the effect of giving an intravenous infusion of iron at the ability of the body to perform better, people to feel better when they're given this intravenous iron when they're really quite sick. And it's looking to see how they can walk on a treadmill, how they can live normal lives, and if they can improve in their symptoms and quality of life.
Are there any indications that there are benefits from intravenous iron at this stage, or is it too early to tell?
Intravenous iron has been shown in a large study in Europe to improve symptoms, some parameters of ability to exercise, and also improves heart function. What we want to do is go further and see how that impacts on people's ability to exercise under maximum conditions and also on their quality of life using a different sort of population, an Australian population, and to see whether it is able to help these people who are really very quite sick.
And we're talking about a very large cohort within the community, aren't we? Because, heart disease is a significant problem for large numbers of Australians.
Unfortunately, heart disease is the biggest killer in Australia. Heart failure itself, whether the heart is weak or damaged, affects around 300,000 Australians, and an additional 30,000 Australians are diagnosed with heart failure every year. It makes people feel tired, short of breath, have swelling in the ankles, and has a very high mortality rate. It kills people faster than most cancers.
In respect to iron deficiency, what impact does iron deficiency have on the heart?
Iron is very important to the body. It helps the body to produce red blood cells, which carries oxygen around the body. If there's not enough oxygen, no organ is going to function properly, particularly the heart, which works very hard. Iron's also very important in muscle function, and I always tell people the most important muscle in the body is the heart. If there's not enough iron, the heart will not work properly.
The extent of iron deficiency as a problem in the Australian community, is it significant?
Iron deficiency is a big problem in the Australian community, and it often goes undiagnosed and under-recognised because if you don't look for it, you're not going to find it. So the thing to do is to have a blood test looking at the iron levels, and if the iron levels are low, trying to supplement that will improve things. Unfortunately, if people have chronic disease, taking oral iron as a tablet is not going to be good enough, or even a liquid, and it frequently has to be given intravenously to overcome the inability to absorb tablets or liquids of iron.
So taking iron intravenously then becomes a significant and vital option for these particular individuals.
People who have chronic illnesses don't absorb oral iron. They have to have it intravenously to be able to supplement their iron, to improve their iron levels, and to allow their red blood cells to increase in number, to allow muscle function to improve, and also to help heart function improve. Giving intravenous iron up until recently was a big problem because people had to come into hospital for 6 or 8 hours for an infusion, but newer preparations are much more convenient and can be given over very short times, often avoiding hospitalisation.
So, Professor, can you tell us how does iron deficiency impact on heart failure?
Iron deficiency is a very important condition affecting the heart. If someone has heart failure and they have iron deficiency as well, it's associated with worsening symptoms, worsening heart function, and they're more likely to have other conditions which affect the heart badly, like kidney impairment, diabetes, low blood pressure, abnormal heart rhythms, thing called atrial fibrillation, and overall they do much worse if they have iron deficiency. We also know that if we give those people intravenous iron, that it improves those other conditions and it may well have a significant impact on the heart. We're actually looking at that at Concord Hospital in our research project, and we believe that giving the intravenous iron will dramatically improve symptoms and hopefully survival.